You know, if you have hepatitis B, okay, and you are not showing any symptoms, okay, you are not showing any symptoms, so you don't bother going for the checkup, okay, you'll be there 2 years, 3 years, okay. Some people, their immune system is strong to the extent that they can keep the virus in cage, like in check. They will not allow the virus to multiply and go and attack but their liver. That is why most people, they can have hepatitis B. Anytime they do the test, everything will be okay, especially their liver will be okay. Because you have hepatitis B and you go and do your liver test and there are some parameters that are high, please don't what joke with it. It is a signal that the virus is trying to what to attack what your liver, okay, causing what inflammation. There are some parameters that are in the liver test that will show that your liver is experiencing what inflammation. It is not normal, especially if you are having hepatitis B or you are a B patient. And one thing is, if these particular parameters, I mean, they are above the normal level for certain months, let's say more than 6 months, don't just sit in your house and do nothing. Start treating before it gets serious. Okay, most people think, oh, or sometimes the doctor may not sound serious based on just some two parameters being above the normal level, so they will just ask you to do certain things and keep testing. But if after 6 months you did the same test and the parameters are still high, after another 6 months those same parameters are still high, it's a signal that the virus is doing everything possible to break down your liver. Don't sit in the house and do nothing. Start working on it before it gets serious, because when it gets serious you spend a lot of money. This part people are not telling you. Treating hepatitis B is not that easy. You spend a lot of money if you don't handle your condition well from the beginning. People wait for the real symptom of hepatitis B, like jaundice, your urine and abdominal pain continuously. They will wait until all these things before they start running to the hospital. All that I'm trying to say is, if you have hepatitis B, try and be checking your liver consistently. If you don't have money, go and borrow money, because if anything happens to your liver, you spend a lot of money. So as a heavy patient, try and be checking up on your liver regularly. If you don't have money to afford other tests, it's fine, but your liver is very important, because when the virus gets into your system, the first organ that they target is your liver. They will start eyeing your liver. They will find a lot of way to attack your liver. So please don't play if you are having hepatitis B. The fact that your results are showing negative, your liver, everything is okay, you have been doing it constantly, doesn't mean you should stop. Continue doing it until what the results stay negative like that forever. I'm talking about the liver test, everything will be normal. If you started seeing something like abnormal results, some parameters are high, go to the hospital. Let them start treatment immediately before your liver gets damaged. You'll be hearing things like, oh, the liver is one of our organs that is strong, it can generate something when it can heal itself. Yes, the liver have that ability, but as soon as you are a hepatitis B patient, that ability will decrease, because the virus will do everything to stop the liver from what healing itself. That is why it's very important as a heavy patient to be checking up on your liver. Kindly what take note.